Good evening, everybody, and welcome to tonight's Robert Veltheer lecture series hosted by Home on the Hill. My name is Karen Silvers, and I'm the Ward 5 Councillor for Richmond Hill and very proudly affiliated with the Home on the Hill organization for many years. I know that Kathy did introduce our MP, and I believe we will also have our MPP, Daisy Way, who will drop in as well. And I see my seatmate and colleague, Ward 4 Councillor David West, is at the back there. I would like to introduce him as well. Lots of familiar faces. We have Etty here from the Peruse Centre for Mental Health and Wellness. Thank you so much for being here. And to everybody, welcome. Home on the Hill is a local grassroots organization developed by the families of those diagnosed with mental illness in the Richmond Hill area to address the gaps that we find in our overall mental health system. One of those gaps is the need for greater information and knowledge regarding serious mental illness and the effect it can have on individuals and their families. And there are many in this room who have possibly been affected by that. And that is why the Robert Veltheer Lecture Series was created and named for the founder and true heart behind the Home on the Hill organization. I will forever hold dear the fact that I knew Bob and knew what a caring, loving man to his family and to others. That love and commitment to those in need can always be seen forever etched in the beautiful face of his wife, Maggie, who continues to play a central and vital role with this organization, and of which we are all so grateful. It's been my privilege, both as a member of council and just as Karen the person as well, to open these evening lecture series for many years now. I hold this honorable task as a true reflection of my ongoing and unwavering support and endorsement of the continuing work Home on the Hill does for, with, and in our community. I'd also like to recognize those in attendance this evening who have lost family and loved ones to the unrelenting and inexorable grasp of mental illness. May you all be blessed with peace and the knowledge that we are here for you to lean on through troubled and difficult times. We are family and bound together both in tangible and intangible ways. Home on the Hill's Robert Veltheer Lecture Series offers us a quiet and welcoming respite which enables us to leave our worries behind just for a moment and know that we are embraced and accepted by all gathered, by all sharing a common place and a common purpose. And tonight, we are gathered to welcome and listen to Dr. Laurie Triano, who will talk about the grief experienced by family and loved ones who are affected by the daily grasp of mental illness. I will now pass the mic over to my dear friend Eleanor Silverberg, one of our local and much respected experts on grief and the grieving process, who will introduce this evening's esteemed speaker. Thank you, everybody.
Hello, everyone. It is indeed a pleasure to be here. I was so happy when Kathy asked me to introduce our special guest speaker, who is talking about grieving the losses of those affected by serious mental illness. I believe you have come out this evening because in some way you are affected. We definitely need to shed light on this very important topic. This very important topic that often goes unspoken, to acknowledge loss as it relates to mental illness, to assess the impact of the losses, and assist with strategies for processing the grief. Grief is a reaction to a significant loss. Although stated simply, there is nothing at all simple about grief. It's here, it's there, it's everywhere. It takes up every day of our lives as we carry on after circumstances of loss or during circumstances of loss. Just as we need to breathe for life, we need to grieve for healing. There is a poem that you may have heard where grief is likened to the ocean, coming in waves, where sometimes the water is calm and sometimes it's overwhelming. And all you can really do is learn to swim. Our guest speaker, Dr. Lori Triano, has ridden the waves personally and with her clients professionally. I've had the pleasure of meeting with her before this session, and not only is she a lovely person, but she has an impressive list of credentials. Dr. Lori Triano is a registered psychologist in the province of Ontario, having obtained her PhD from York University in 1998. She currently works in private practice in Hamilton, Ontario, in the areas of clinical and rehabilitation psychology. Her particular interest and expertise lies in the area of grief and trauma, providing treatment to individuals who have been impacted by a violent crime, a traumatic incident, and/or who have experienced a significant loss. She's a former board member of Niagara Victim Services, and she previously served as the professional consultant to bereaved families of Ontario in in the Hamilton Burlington chapter. Dr. Triano has given many invited presentations on the issues of grief and trauma, and she has been called upon by the media to speak on these topics. She currently sits on the Hamilton Chief of Police Committee for police interactions with people in crisis. For her personal and professional advocacy in promoting social justice for those living with mental illness, Dr. Triano was the recipient of the Outstanding Achievement Award presented by the Schizophrenia Society of Canada in 2013. And she is now the current president of the Schizophrenia Society of Canada Board of Directors. Without further ado, it is my great pleasure to pass you on to our speaker, Dr. Lori Triano.
Thank you for the introduction, and thank you for coming out this evening. Thank you to Home on the Hill for the invitation to speak tonight on grief associated with losses affecting those with severe mental illness and their family caregivers. It's a topic that's not often spoken about, so tonight it's my goal to provide you hopefully with some information and education with regards to grief and the grief process. And it is my hope that in providing you with this information, it will serve to highlight the realities of the different losses faced by those with a serious mental illness and their family caregivers. And it's my hope that this information will in turn serve to validate the grief reactions that many of you may be experiencing. Grief experienced when one is affected by a severe, enduring mental illness is a grief that is not often recognized or even considered by others. It's a disenfranchised grief, if you will. Our friends don't think about it. Our colleagues don't consider it. And sadly, it's a grief that is often overlooked by health professionals as well. But it's important for you to be aware of your grief and your grief reactions. For grief that is unattended to can impact your physical and your emotional well-being. As noted by Eleanor in the introduction, I'm a psychologist in private practice in Hamilton, Ontario. And in my practice, I work a lot with bereaved family members, particularly bereaved parents, who have lost their children, typically by traumatic means, through suicide or homicide or car crashes. I also work with family members whose children may have acquired a brain injury, so they have a loss of a different sort through their injury. And I work with individuals who have mental illness of varying degrees and severities, who too, through their illness, have experienced a number of different losses. So I have some book knowledge, if you will, or some clinical knowledge, and I also have some personal experience with grief as well as some personal experience, more secondary, with severe and enduring mental illness. In terms of my book experience or my clinical experience, as part of my graduate training, I completed an internship at the Hamilton Program for Schizophrenia. And it was through that training that I came to witness firsthand the impact that a severe and enduring mental illness can have on an individual and that individual's family. I saw families come to understand, struggle to understand the illness and the impact the illness was having on their loved one. And I worked with individuals diagnosed with schizophrenia who were trying to understand their illness and their symptoms. I saw that while some individuals gained insight into their illness, some never did. And I saw how a psychosocial rehabilitation program could support individuals and their families in recovery. While I was at the Hamilton Program for Schizophrenia, I stayed on after my internship to complete my doctoral dissertation. I examined the effectiveness of a cognitive retraining program in individuals with schizophrenia. I took on this project because of the association between some of the neurocognitive functioning of individuals with schizophrenia and their symptoms. So for my project, I worked closely with 7 individuals with schizophrenia, and I carried out an attention process training program to see if we could improve the attention of individuals with schizophrenia. And the results indicated that we were able to lead to some improvement in the attentional functioning of the individuals with schizophrenia, although it didn't generalize to other cognitive abilities such as memory or some of the more higher order problem solving. Interestingly though, the improvement in attention also led to improvement in some other negative symptoms, which I will briefly describe later, and some other areas of functioning as well. When I was at the Hamilton Program for Schizophrenia, I also met my dearest and my best friend who joins us tonight. I learned early that her brother and her brother-in-law both had diagnoses of schizophrenia. Her brother-in-law sadly died by suicide. I asked my friend if she could share with me the impact that the illness had on her brother and on her family. She described her brother as a very popular high school student, captain of the hockey team, who had just begun his college studies. He was an outgoing, popular guy, but then he became more withdrawn. He started to sleep in his car. He didn't interact with his family and friends, and his self-care deteriorated as well. The family, of course, began to wonder what was happening and what was going on with their brother and son. And they were worried, of course. So they began their journey through the healthcare system, and in time, her brother was diagnosed with schizophrenia. I asked my friend to recall her thoughts to me when she heard the diagnosis. And her first thought was, my brother has schizophrenia. Knowing that this was a lifelong illness and wondering what this would mean for him and his future. She knew his future would be different than anticipated or hoped for. And this, of course, saddened her. The brother that she had grown up with was changed by the illness. On a positive note, in time, and it took a long time, but with proper care and treatment, her brother has now come to a place where he lives semi-independently, and she shares a very positive relationship with him. Some 22 years ago, I also lived beside a woman who suffered from a severe and enduring mental illness. Of course, when we initially moved into our home, I wasn't aware of her mental illness, but why would I be? But I later learned, as I will briefly outline, that my neighbor had a severe and enduring mental illness. And I later learned that she had a history of erratic behavior. Over the years, she had come in contact with the hospitals, with various doctors, various psychiatrists, and on a number of occasions, the police. But my neighbor was never properly assessed or treated. There appeared to be no lack of follow-up and no coordination of service. And my neighbor lacked insight into her illness. So when she was discharged from hospital with her antipsychotic medication, she felt no need to take it because, as I said, she had lacked insight into her illness. So she was left untreated. Initially, interactions with our neighbor were quite pleasant. We would talk over the fence, over the front yard. We would share tea or ice cream. She seemed happy to have new neighbors. But in time, first after the death of her son, and then later with the pending birth of mine, we saw her behavior begin to change. We saw glimpses of her mental illness, her erratic behavior, which we later learned was guided by her delusional thinking. Her symptoms further increased when my son was born, and her behavior became more erratic and more aggressive, and at times violent. Although, as many of you know, most individuals with schizophrenia are not violent, my neighbor was aggressive and violent, and I feared for the safety of myself and my son at times. Given her behavior, which, as I said, was often aggressive, and her delusional thinking, which became more apparent over time, we called the police to our home more than a dozen times over a 3-year period, always with the hope of having her apprehended and assessed and into treatment. Her daughter also tried, without success, through the doctors and through the justice of the peace, to have her mother apprehended, assessed, and into the treatment she needed. But she too continually hit barriers. Her daughter didn't understand her mother's behavior or her mother's mental illness. I spoke often with her daughter given her mother's behavior, and on one occasion she had commented to me that the doctor had indicated that her mother had paranoid schizophrenia, and she asked me what that meant, clearly reflecting the lack of family involvement and family education. She didn't understand her mother's mental illness, and she didn't understand the quality of her mother's delusional thinking, which characterized the illness. On one occasion, she told me that the neighbors thought that my son was her son. But her daughter, told her mother, "You know that's not true, Mom." My neighbor's daughter, as I said, did not understand her mother's mental illness, and she did not appreciate the quality of her mother's delusional thinking. She tried to correct it, and she tried to challenge it. But in the end, it was her mother's delusional thinking that formed the basis of her actions to murder my son, to release the spirit of hers. On March 27th, 1997, my neighbor killed Zachary, stabbing him to death while he played outside with his friends. and I was thrown into the middle of an emotional earthquake. I was thrown right into the middle of this thing we call grief. I felt very alone and afraid. I was overwhelmed. I didn't know what hit me. I had experienced the grief of my grandparents, and then later in life, the death of my best friend, but nothing compared to this grief that took over me following the death of Zachary. After the initial shock and numbness wore off, I began to experience emotions of great intensity to such a degree that I have never experienced before. Emotions that were so strong that they overwhelmed me and my ability to cope. I was rendered almost non-functional for a year. I felt profound sadness, which really doesn't describe the sadness that characterizes grief. It's an indescribable sadness, unimaginable. I also experienced anger at the criminal justice system for failing to intervene. I felt guilt that I was unable to protect my child, guilt that he had to die while I was still living. In addition to these emotional symptoms, I also experienced symptoms that were more physical in nature, as well as cognitive symptoms. Although I was doing nothing, I was physically exhausted. I was so tired. My sleep and my appetite were impacted. I couldn't fall asleep, and I couldn't stay asleep for many months. I didn't feel like eating initially, and then in time I ate too much. And as I said, in addition to the emotional and the cognitive symptoms, in addition to the emotional and the physical symptoms, I also experienced cognitive symptoms. My brain was not working as it used to. I couldn't focus. I couldn't pay attention. My memory was poor, and I struggled to make decisions. And on top of the emotional, the physical, and the cognitive symptoms, I was also experiencing social symptoms or a change in my social interaction. I was once confident, independent, and outgoing, but I no longer felt confident, perhaps because I didn't feel myself. I was so overwhelmed by all that was going on inside of me. I felt so different. I feared going out. What would people ask me? And what would people say? I was overcome with grief, and I wondered if I would ever come to be able to live again. Honestly, in the initial months after Zachary's death, that didn't ever feel like a possibility or a possible reality. Before moving to discuss a little bit more about the grief experience in general and the process of grief and grieving, I just want to talk briefly about the topic of severe and enduring mental illness, to highlight some of the symptom experiences, some which represent direct losses, and which others, by their nature, lead to losses. When we hear people speak of illnesses such as schizophrenia, we typically think of the positive symptoms of the illness, the hallucinations, that people hear voices that aren't there or see things that aren't there. Or we think of the delusions, the false beliefs that people hold. When we think of bipolar disorder, we think of what used to be called manic depressive disorder and a rapid change in mood or affect. When we think of these disorders, we don't think of the range of symptoms that characterize them. The symptoms that impact social functioning, occupational functioning, or school functioning. When we talk about schizophrenia, in addition to the positive symptoms, or the hallucinations and delusions, there's also what we call negative symptoms, as well as cognitive symptoms. The negative symptoms of schizophrenia indicate a reduction of capacity, a loss of capacity or function. There's an emotional flatness or a lack of emotional expression. There's a reduction in facial expression or eye contact. There's a loss or a lack of motivation. So the individual struggles to initiate activities, to plan them, and to follow through. There's also a loss in the ability to experience pleasure or enjoyment in life. There's difficulties with social cues and understanding them. Difficulties then in relationships are common, so there's often a loss of social interaction. Many, if not all of the disorders within the schizophrenia spectrum are characterized by impairment or disability in social and occupational functioning. So that represents another loss, a loss of ability or a loss of potential. As I said earlier, many of the severe and enduring mental illnesses are also characterized by cognitive symptoms or changes in our thinking process. People living with schizophrenia often struggle with executive functioning, as I mentioned earlier. So it's hard for them to plan, initiate, and follow through on activities. They struggle with memory and with organizing their thoughts. In addition, they struggle with attention, as I mentioned earlier. When we think of bipolar disorder, there's also cognitive symptoms. In the manic phase, when there's distracting and racing thoughts, people can't focus. In the depressive phase, there's again an inability to attend or a difficulty making decisions. And as many of you can imagine, cognitive functioning is involved in almost everything we do on a daily basis. Getting up, planning your day, following through, remembering your appointments, paying attention in conversation. An individual with severe and enduring mental illness, because of these deficits or losses, often shows secondary losses in terms of social functioning, occupational functioning, school functioning, and self-care. And another common deficit that I mentioned earlier is lack of insight, when someone is not aware that they have an illness. And as I mentioned, my neighbor lacked insight into her illness. This lack of insight or understanding is based in the brain. It's not a choice, and it's not denial. And as you can imagine, it can make treating and working with individuals who lack insight quite challenging. So as the symptoms of the various severe mental illnesses reflect, there are many different losses involved when someone receives a diagnosis of schizophrenia or another mental illness. And there are many secondary losses as well. When one experiences a loss, the normal reaction is grief. Grief is the normal process, as Eleanor said, of reacting to a loss. And the loss may be, as I described in my own personal experience, a loss by death. But it may also be a loss of function through illness or through injury. And grief, as I described, is the process of experiencing all the emotional symptoms, the psychological symptoms, the cognitive symptoms, the behavioral symptoms, and the physical reactions to the loss. When we consider severe mental illness, and we take into account the range of symptoms that we've already described, we can see that some of these symptoms in and of themselves represent loss. There's that loss of motivation, loss of the ability to experience pleasure, loss of some of your cognitive capabilities, and then there's the secondary losses, loss in your potential to succeed occupationally or vocationally. There's a loss in the way the individual used to function. As we said, there's a change typically in one's ability to maintain their academic performance or their work performance and to engage socially. Given these changes, there is most often a loss of the future as it was initially anticipated or expected. There's a loss also of certainty as to what the future will look like. For family members and caregivers, some parents have described that they have lost who their child used to be. Some parents will describe that the child they knew and raised has been changed by the illness. Some parents have noted that in the initial phases of the illness, their child seems like a stranger. They have used the words, "I have lost my child to this illness." In the words of one mom, she asked, "How could this be happening? I have lost the son that I knew, and I don't know if he will ever be back." When your child or you experiences these changes, there's often a loss of hope and dreams for what you anticipated the future to be. There's often a loss of the former relationship with your child. There may be fear, so there's a loss of sense of safety and security. I recall meeting with one mother whose son was highly delusional and not well treated at the time, and owing to his delusions, he tried on a number of occasions to harm or kill her. She, of course, deeply cared for her son and loved him, but was now afraid of him. And she voiced losing the son that she had known and feeling very unsafe, so that loss of security. On a positive note, last we spoke, her son was on medication that was working well and was part of an assertive community treatment team and doing much better. Other losses for the individual who receives the diagnosis or family members may include loss of time spent with friends. For the parent, this may be owing to the needs of the child that takes up some of their time, or it may also be due to the ongoing stigma that sadly still persists, especially, I think, with severe and enduring mental illness. Parents can experience, as well as the individual with the diagnosis, rejection and isolation and feel very alone. For family caregivers, there may be a loss of freedom in time or independence, again, because their child's needs may be greater. There may also be a loss of finances, depending on the needs of the child. Further, for the family member supporting an individual with a severe mental illness, there may be a number of internal losses that even they may not be aware of. There may be a loss of self-esteem, a loss of confidence, often a loss of control because you can't control the illness, a loss of pleasure in your child's successes, a loss of hope, as we've mentioned, loss of security and certainty because the illness is not always certain. There may be a loss of your religious faith, a loss of the family dynamics as you once knew them, a loss of privacy, a loss of sense of spontaneity, and a loss of faith in the mental health system. There are many losses when one is diagnosed with a severe mental illness. And as I said earlier, with these losses comes grief. And Kathy and I were talking earlier that often even parents and family caregivers don't recognize that they may be grieving. But there's all these losses that we have described. Initially, there may be denial when you take note of these behaviors. You may think, well, this is something that will pass. But when the symptoms persist and it doesn't pass, and you seek assistance and receive a diagnosis, there may be initially a sense of relief because now you have some understanding. But that quickly does then turn to grief as you understand the illness and the impact. And with such grief, the individual who's received the diagnosis, as well as the family caregivers, will experience a range of symptoms that I described, very similar to my own personal grief experience. Emotionally, there will be sadness with that loss of hope, devastation, anger, anxiety, hopelessness, helplessness. People often feel lonely and isolated, again because of the shame and stigma. There's a sense of embarrassment sometimes. Family caregivers may experience guilt or self-blame. And cognitively they might struggle as well. Related to the feelings of guilt, in the words of one parent, she stated, "I racked my brain and kept thinking of all the things I could have done differently to prevent such a horrible illness. The guilt for me was overwhelming. I was so alone and couldn't talk openly to friends about this horrible ordeal. I felt ashamed. I've been through an intense amount of pain watching the effects of this illness on my beautiful son. I have dealt with shock, sadness, guilt, anger, and fear, to name a few of the emotions." Another mom, this was shared in a blog in Psych Central, wrote, "I was terrified. I knew enough about schizophrenia to know that without treatment, it could go to a very bad place. I wanted my son to get help, but owing to his inability to recognize that he was sick, he didn't. So he checked himself out of the hospital on a very low dose of Risperidol, and we came home only to discover that there were no psychiatrists in our area. It took about 7 weeks, but we finally found our place into a local psychiatric nurse practitioner's practice. And with gentle encouragement, and with educating my son Thomas about his illness, he got to a point where he agreed to a full trial of medications. Sadly, though, with his diagnosis, we said goodbye to the dreams that we had for his future. It wasn't that they all died that day, but there was a loss that both he and I experienced. The things he wanted were either denied or put on the back burner. And I said goodbye to the young man that I thought he would be. I began the grieving process that comes along with being the parent of a child with schizophrenia. I watched as he slowly disappeared into the illness, but I didn't stop hoping for better days. Though few and far between in the first few years, the better days finally began to add up when we found the right combination of medication and treatment. It has only been recently that we have seen significant improvement, but we have learned that sometimes the stability is fleeting. With a few good weeks behind him, Thomas started to have some setbacks. For us, this is the nature of his schizophrenia. 2 steps forward and 1 step back. And because of that, we have to readjust his expectations and ours. As we sidelined the more lofty expectations of a full remission, which was beyond our grasp, we found a way somehow to hold on to hope. Like a lantern in the darkness, hope is our only reprieve. With his strength that awes me constantly, and with my determination to help him have more better days, we gather around hope's light and we hold on to it. And in its glow, we find acceptance of schizophrenia's presence in our lives. And in doing so, we find some peace that can anchor us in the storm. In her words, we hear adjusting, accepting, and adjusting. And these are words and tasks that we need to do in our grief. When we experience a loss, we all grieve differently, and we all grieve at different intensities. And the grief that one experiences within the context of a severe and enduring mental illness does differ in some respects from the grief following death. I think every grief is different depending on the loss. In the case of death, each grief is different depending on how the individual died. But in the case of severe and enduring mental illness, parents are confronted at times, because their child is before them, with the reminder of the discrepancies between what their child used to be like and what they hoped for and where their child is at present. One dad described it like this: I could look into my son's eyes and see glimpses of what he used to be. And this is a different experience than when your child dies. I always wonder what Zachary would be like and what he would be doing, but I'm not sort of faced with his presence in a different body every day. So we can't compare them, but they're very different and yet very similar. And like I said, we all grieve differently. Grief is unique, and different factors will impact our grief. Many will describe grief as a roller coaster of emotions. Grief ebbs and flows. You may feel the grief at different intensities with different milestones throughout life. While some aspects of the grief will diminish over time, some will persist longer. My anger was quick to subside, but my sadness and longing persisted. Grief, contrary to the popular held belief, does not occur in stages. It is not a linear process with a start and a finish. It ebbs and flows, and there are processes or tasks that we have to work through in our grief. And I know from reflecting on my own personal experience and looking at the literature in terms of the grieving process and the tasks of grief or the needs of grief and mourning, that it takes work to progress through these tasks. It takes work to be able to readjust for me to not having my son physically present, and to readjust for many of you to the many losses I described earlier. We want to readjust those so we can then reinvest in living again. And I would suggest that for those impacted by severe mental illness, that just as I progress through all these tasks, you too need to do the work. And for family caregivers, you too may have some work to do. But it's important to do this work so you can adjust your expectations and so that you can develop new relationships and new ways of being, to allow yourself to come to a place where you can reinvest in living and this new reality of yours. For the parent caregiver, it's important that you tend to your grief needs so that you can adjust and be more in tune to your child's needs. And research does suggest that when one comes to understand the illness, when one has supports and programs in place, the grief does tend to decrease with improved coping. So what is this process of grief, and what is this work that I talk about? The first task is recognizing, acknowledging, and understanding the reality. You have to work to come to reconcile with the diagnosis and to accept what that diagnosis means. So you first have to come to understand the illness, and then what the illness means to you. As I described earlier, there is a period of time where you may want to deny the reality, but in time, you know you can't. You seek understanding, and you seek to understand the mental illness. And understanding mental illness is not easy. If it had not been for my time at the Hamilton Program for Schizophrenia, I would never have come to understand the mental illness of the woman who killed my son. It takes work to understand. And there are many interactions you will have within the healthcare system. Sadly, some may be better than others. Some parents voice that the process to coming to understand the illness leads to confusion, guilt sometimes, anxiety, and often feeling very overwhelmed. And although, like we said, a diagnosis may bring relief in time as you learn what the illness is, it brings some grief. Learning that your child has a severe and enduring mental illness is intensely emotional. Acknowledging this and somehow coming to reconcile with it and accept it takes hard work. When individuals receive a diagnosis, they come to sometimes seek even a further understanding. Understanding not only in terms of what the diagnosis means for their child and their life, but there's often the bigger question of why. Why did this happen to my child? I said the same question. Why? Why my son? Why my family? The why question is common in grief, following death, and also following the diagnosis of a severe mental illness. And although the answer can be straightforward, well, it was death by homicide, or death by cancer, or death by a car accident, or schizophrenia involves brain chemistry, there still is that big question, why me, or why my child? But getting stuck on this more ultimate question of why and leaving it at the forefront can get you stuck in your grief. Somehow we need to surrender to that need to know why. And we need to work to accept the reality and what that brings. And working through this understanding, like I said, is difficult. But after you acknowledge the reality or recognize the diagnosis, you then have to react. And you have to process all the emotions that come with that understanding. So first, there's recognizing, and then there's reacting. You have to begin to feel these emotions. And this is another task, if you will, of grief. And this is necessary to allow you to come, really, to reconcile with what the diagnosis means, what the losses mean. And then after you recognize and then you react, you have to work to relinquish the prior relationship. Because as we said, it will be changed to some degree. I had to relinquish a relationship of physical presence with Zachary. And I had to readjust to a relationship of memory and an ongoing connection of love. And you too have to adjust. And although life will be different, I think it's important to remember that it can still be good. And as one adjusts to new ways of being, you can then reinvest into new goals and new ways of living. So it's necessary to work through these tasks of recognition, reacting, relinquishing, readjusting, and reliving. And by working through these tasks, it does allow you to let go of some of the past and reinvest into the present and the future. As one theorist pointed out, in his words, working through one's grief can bring you to a place of accepting the irreversible nature of the loss, of working through and discarding old patterns of thinking, feeling, and acting to a place of gradual acceptance that the loss is permanent and life must be shaped anew. So this accepting of the new norms and the new relationships is really one of the final tasks of grief work, and it can take a long time. We were talking about this before as well, and I know my friend had said it took a long time for her brother to get to that place, but he is now there. So how do we accomplish all these tasks to get to this place? Well, work, like I said, and in order to do this work, you need support. You need support of family and friends who will be there with you to listen, to help you understand, and to react to these emotions. You may need the support of professionals. Well, I think you likely will need the support of professionals. And equally as important, the support of peers. Peer support is important. To be with other people who have been there, who have worked through their own grief and have found ways of coping and managing. After the death of Zachary, as I said earlier, I wondered if I would ever come to live again. But with much support and with that hard grief work, I have been able to get to a place where I could reinvest in life and in living. Zachary now has 2 siblings, Ethan and Abby, who were born after their brother, but who know of him well. And I have a busy practice in Hamilton, like we said earlier, where I work often to make meaning out of my tragedy and progress from my pain. And I know people who have loved ones with a severe mental illness who have also got to a point where they can come to understand and support their loved one and reinvest in life and a new way of living. The word recovery is often used today of patients. Recovery is a process of reclaiming one's life and living beyond the losses that you experience. Dr. Pam Forsyth, a psychiatrist and former president of the Schizophrenia Society of Canada, says recovery is about getting your life back and discovering a path of living beyond the limitations of the mental illness with a sense of purpose and meaning. There can be life after loss, as I have learned. And there can be life after a diagnosis of a severe and enduring mental illness. But as I have described, it takes a lot of hard work and it requires support. You have to work through your grief to discover the new you, both for the family caregiver and for the individual with the diagnosis. And it's entirely normal to experience the range of emotions that we described earlier. And acceptance or resolution or reconciliation can take time, both for the individual who's received the diagnosis as well as their family members. And the acceptance, like we said, takes place at different rates for everybody. But it requires that you come to terms with the losses or the degree of disability imposed by the symptoms of the illness. And this takes time. So be patient with yourself, try to be patient with others, and when this is done, small measures of recovery can give rise to some optimism and some pleasure. So be patient and have hope. And that will bring us to the end.
I stand in front of you as a person who dealt with mental health some 40 years back. I came to Canada at the age of 18, some 40 years ago, and as an international student, I found it very difficult to be able to integrate. Not because I didn't want to, just because I came from a different culture and language. Initially, was a barrier to success. And being the only child from a very small and conservative family, I found adjusting to Canadian lifestyle quite challenging. My heartbeat goes up despite the fact that I've been around for 4 years and I've managed to do very well. As you know, I stand in front of you tonight, as a member of parliament. Only in Canada this could happen. Back then, stress, anxiety, depression, suicidal thought, in my case, were very much associated with challenges of integrating for a newcomer or for an international student. Very little help was available. And the symptoms were probably not understood. The stigma was there. You were the awkward kid who did not want to mix and mingle. So it was challenging. Today, things has changed. Today, people are becoming champions. Today, we have someone like Maggie, someone like Catherine, who are actually taking the torch. As a member of parliament for Richmond Hill, when I was going through the initial outreach that I stand, one of the items that came up a number of times was the issue of mental health. And it was at the early days of my parliamentary life that the name Robert Veltheer came up, and Home on the Hill came up, and I met Maggie, and I started talking to my colleagues, and very soon I realized that, hey, look, there's so many people out there that they are actually dealing with mental health. The anxiety came back, the stress came back. Some of you may or may not know that I published 3 articles on the life of an MP, a new MP, and all the stresses. So again, very quickly I went back to 40 years, and I seeked help. And I managed to start the Liberal Mental Health Caucus. There were a lot of side conversations, and the Liberal Mental Health Caucus turned into a federal mental health caucus, and all parliamentary. So now we have senators, we have members from all across the parties that they're coming, and we've taken a number of initiatives. One of them that will be voted on will be actually tomorrow at I think around 5:30 in the afternoon. We're going to vote on a private member bill that I brought to the House, and it focuses on, actually it brings a legislation that during the pre-sentencing, the mental status of an individual will be taken into consideration, as well as making sure that that individual receives all the programs that's needed during the incarceration to be able to help reintegrate. Some of you, I think there was a gentleman who got up and talked about the fact that he's finding it very hard. I commend you on standing up and talking about it. It is very difficult. It is very difficult, and it's challenging. And again, those are the little things that we can do. As often whether you're 1 out of 5 or whether you're 4 or 5, you see a lot more women standing up and talking about this, because men are not comfortable getting up and talking about this. So I want to carry that torch as someone who will stand up and talk about it. We also talked about, I think the doctor talked about the fact that the services are not there, and the accessibility, and the scope, and all. These are all goes back to the fact that we don't have a parity. We don't have parity between mental health and physical health. You get sick, maximum is you jump into the emergency and you'll get treated. You go to emergency, they hold you for about 7 hours max, and then they say, okay, you know what, go back, and if you're dealing with anxiety and you have to wait 8 months or 8 weeks, anxiety goes to depression, depression goes to, suicidal thoughts. I don't need you all know about this, so this is not as much about trying to say or trying to echo what's been said already or what you know, but the whole point of it is we are at the early stages of stigma, but we also need to hold sessions like this, and we also need to become a champion for parity. one of the items that was discussed about was how can we make sure that we play a part into it. How can you make sure to do that? Come and hold home on the hill. Volunteer. Okay. What we need community-based mental health services. We need peer support. We need champions, and each one of you could be a champion in your own way. So I don't want to go on again. This is very, very important. On my part, I'm trying to do the legislative work because it's a federal, so the fund has been already, allocated. We've come up with $5 billion over 10 years. 1.9 billion of that is coming to Ontario. And proud to say that Premier Ford has also identified another 1.9 billion over 5 years dedicated to mental health. The federal government is working very closely with the provincial government to make sure that those funds now start getting released based on evidence that the fund is going to make sure that we get the services and we invest where we need to invest so everyone can get the support, but the support starts here as well. Community got to come together, and please, please support Home on the Hill. Thank you.